Good afternoon, guys. This is Rich De Silva. Today we're talking about shoulder pathology. So how do people injure their shoulder? Overhead activities, this is a main cause. We're talking throwing, lifting, pulling, acute injuries, trauma, car accident, things like that, or a chronic injury that could develop over a very extended period of time. Some signs are stiffness, decreased range of motion, loose, unstable shoulder, or weakness, sometimes even a clicking noise when you abduct or rotate. So there's four main problems, major. We'll call them instability, labral tear, bursitis, and rotator cuff tear. First, bursitis. It's caused by a decreased space between the humeral head and the acromion. It could be caused by hooked acromion. It could also just be caused, a couple of cases that I've seen, they're just incredibly close together, the head and the acromion, and that's when they do the decompression and they get more space in there and free up the impingement. Could also occur in the acromioclavicular joint. Still having trouble with that one. It could also be caused by a bone spur, but in the case of a bone spur, it would be the same thing as the hooked acromion. It's the bone wearing down on the tendon over time, motion, and eventually cut, pulls, or snaps. Signs are aching, clicking or catching, overhead movement. You get sort of that, like, as you abduct or flex, which would be kind of out to the front and down, moving your extended arm posteriorly. I was wondering how to say that. Second would be your cuff tear. So it's caused by impingement, aging, trauma, could be any number of things. It is pain, inability to abduct really at all or without extreme pain. Tears can be partial, which would be characterized either as a less than 50% or a greater than 50%, or it could be a full thickness tear, which would just be straight through. Those are the types where you're up in the subacromial and they're scoping around, and all of a sudden you see a biceps tendon, and you're like, that doesn't belong there. Full tear. So there's 5 types of tears. They're relatively self-explanatory if you understand the shoulder anatomy. You have your horizontal tear, which runs from posterior to anterior or anterior to posterior, all the way at the lateral end where the cuff would meet the tuberosity. You'd have a horizontal tear running across, and again, it could be partial or full. You have a vertical tear, which runs from that same place where the horizontal tear would be, but instead of running across, it would run immediately up the cuff. You have your horizontal vertical, which looks like that awful Tetris piece that everyone hated to get back in the day, but they pretended like they liked because they were like, oh no, it can fit into all those cool places. No, it can't, because it has a space on the bottom that you can't do anything with. Useless. Anyway, so that's what it looks like. It looks like a horizontal tear and a vertical tear literally put together. So it's going to be sitting right here, horizontal across, vertical up. There's also an inner substance tear, which, from what I've read up on, seems not very frequent. Everything that I read says it's like the least frequent out of all of them, and that's when you get a tear that looks like a horizontal tear, but it's not at the lateral edge. It's somewhere within the meat of the cuff itself. And you also have horizontal retracted, which are, in my personal cases that I've seen, have been the second most frequent to the regular horizontal, and that's when you get a horizontal tear that retracts farther back. So instead of getting, here's your tuberosity and here's where the cuff would usually attach. So horizontal, it would pull back a bit, whereas a horizontal retracted would pull back a bit and be separated. So you almost get this like U-shaped cavity, or an upside down U-shaped cavity. Those seem to be, from the bad tears that I've seen, pretty frequent. Third, you have instability. I think instability is what most people would just call a dislocated shoulder. You have a dislocated shoulder where the humeral head has completely separated itself from the glenoid, is completely removed from the joint. The ligaments are stretched, the tendons are stretched in the shoulder, possibly even torn. And you have subluxation, which would be partial. Within subluxation, you have anterior, which would be the shoulder popping out the front. and you have multi-directional, which is self-explanatory. Not that way. You also have a labral tear. So a labral tear is when the labrum, which is the cartilaginous fibrous circle that surrounds the glenoid, tears away from the glenoid itself. It could be acute, which would be from injuries. It can also be chronic, which would be from regular dislocations, subluxations, wear and tear of any kind. There's two kinds. One is called the Bankart, and one is the slap. So the Bankart is from 2 o'clock until 5 o'clock. If you were to turn your glenoid into a clock, your Bankart would go from 2 o'clock to 5 o'clock. Whereas your slap would go from, it's really hard to do this backwards, 2 o'clock to 10 o'clock. So like the top of the clock. Really super easy way to remember this that I actually just thought up before. The Bankart is on the bottom, so B to B. Bankart is on the bottom, and slap, you slap someone in the head, and your head is superior to everything. So you slap them in the head, Bankart's on the bottom. Pretty sweet, go with that. Lastly, I actually wrote this one down because I didn't even know about this until about 5 minutes ago. But lastly, you have frozen shoulder. I actually saw one of these and didn't know what it was. So frozen shoulder is when the soft tissue of the shoulder, they fuse where they're not supposed to. So the one that I saw that was a good example was a horizontal retracted cuff that had retracted so far medially and been that way for so long. It was a much older woman. It had been that way for so long that the cuff and the biceps tendon fused together. And that looked incredibly painful. I can't even imagine what that felt like. And it just looked bad. And you had to go in and you had to separate the tissue and you had to pull them apart. And then once they were pulled apart, he was able to finish up the tear repair. But it's characterized by a massively decreased range of motion and a lot of pain. I hope you guys enjoyed my video. That is it for shoulder pathology. We did not go over the repairs this week. I would imagine I'll factor that into my video next week. Hope you guys have an awesome weekend in the meantime, and I'll talk to you again soon. Have a good one.